Very often we get asked of the difference between physiotherapists, osteopath, chiropractors, any alternative medicine that would deal with back problems. One of the key difference, beside the technical aspects, is the fact that chiropractors are educated enough in the radiology field to take their own x-rays. Many reasons for taking x-rays at different ages and for different symptomatologies as well. I would just insist on a few points, however, that for me are absolutely crucial. Before you get your back adjusted, manipulated, stretched, knowing what lies underneath and what you're trying to approach is absolutely essential. And even last week I took 2 x-rays, and that's what made me decide to talk about it today. I took 2 sets of x-rays on 2 separate people, aged 30 to 40, congenital deformities with big fusions between 2 vertebrae. How am I going to explain to those people that my treatment, my manipulations are not doing what they should be doing, probably even increasing the symptoms initially, if I don't have the support, the scientific support to show them that they are their congenital issues, that will never be corrected in the future. So those people would go from physio, osteopath, chiropractors without really knowing what exactly the situation is taking place in their neck. Okay, so why do we take x-rays? We take x-rays to evaluate the structural alignment and be accurate with it, not just a guess from what we visually see, but what the structure is actually shaped as. Second reason is obviously congenital deformities. A good percentage of us are born with spondylolisthesis, so which are congenital misformation fractures, fusions, extra number of vertebrae, cervical ribs. How do you know by palpation that the patient is suffering from that because of those reasons? There is absolutely nowhere that you will find those kind of diagnoses unless you see a chiropractor which will take an x-ray. Of course, the degenerative issues that we'll see on the spine help you also evaluate the progress you're going to be making. So if you want a clear diagnosis, a clear prognosis, and also adapting your treatment properly to what you will see, then you obviously need an x-ray. So I will not repeat it enough. Before you get your spine adjusted by any of us, make sure you have a set of x-rays. If you go to general practitioners to get your set of x-rays, I'll just make that little note important as well. You will get prone or supine x-rays, lying down, no weight bearing, no structural analysis of how you hold yourself and how your body is responding to the weight that you have when you're standing. So again, another point, very important point for you to choose to see your chiropractor to have a set of x-ray and not do it through the NHS. Okay, so please, if you have any chronic phenomenon taking place in your spine, don't go and see somebody that will just manipulate without knowing what's going on there. Get a chiropractor to have a look, get the analysis done there, and I'm 100% sure you'll be much more satisfied by the result that if you don't evaluate the situation a little bit more in depth. Thanks.